Assalamu alaikum. And first of all, I would like to thank all the organizers for providing this opportunity to talk to a wonderful group of experts and students here at at Agriculture University. Topic as already you know that we will talk about antimicrobial resistance in poultry sector in Pakistan. And as we know that we are facing the challenge of many infectious diseases, including bacterial diseases. And in order to control or treat these diseases, antibiotics are commonly used. This extensive use of antibiotics puts up selection pressure on the bacteria, which leads to the emergence of antimicrobial resistance organisms, which are difficult to treat. There are a number of factors which are responsible for emergence or increase in emergence of antimicrobial resistance. The most important factors considered are inappropriate use of antibiotics, which means that use of antibiotics once they were not required, for example, in viral diseases, or they were not used as they were recommended or according to the dose which was required to be used. The second most important factor, which is responsible for the emergence of AMR, is poor infection prevention and control. If we control the infections, if we have a good poor infection prevention control practices or vaccinations available for our animals, then there will be less infections. So less use of antibiotics, and there will be less problem of antimicrobial resistance. And the third most important factor, which is considered, is insufficient regulations on the use and sale of antibiotics. Especially in case of Pakistan, we have regulations for the sale, purchase, manufacturing of antibiotics, but the implementation of these rules and regulations is not proper, which again leads to the excessive use of antibiotics, leading to the emergence of AMR in livestock sector. Antimicrobial resistance is not only affecting Pakistan; it's a global challenge. It's the whole world is affected. And according to one estimates, in year 2022, there were 5 million deaths due to antimicrobial resistance. And this number may rise to 10 million if we will not tackle this issue or this problem. It's not only a public health concern, or it is also an economic concern. According to one estimate, if we will not tackle this issue, the global GDP will face the loss of 1.27 trillion US dollars. So it's a public health challenge plus economic challenge, and we need to control this issue. If we talk about the livestock sector of Pakistan, livestock sector contributes 14.63% to Pakistan's GDP, which is significant. And Pakistan is maintaining a huge population of animals, including poultry. And if we specifically talk about the poultry, it's like around 40% of the meat comes from the poultry sector to Pakistan. It is providing, you can say, employment to 1.5 million people in Pakistan as well. So it's an important sector, and it has its contribution in AMR as well. And if we talk about AMR, it is also a One Health challenge. It means that it is not only affecting animals or humans or environment, it is affecting all these sectors at the same time. And if we want to control this problem, we have to focus on all these sectors to control this issue. So it's a One Health challenge, it's a public health challenge, plus it's an economic concern as well. Pakistan, as we know, is part of this world, is also facing the challenge of AMR. And in order to control AMR issue, Pakistan is also taking different steps. Pakistan has developed Drug Regulatory Authority, which has developed certain rules, regulations for the manufacturing, sale, purchase, consumption of these antibiotics. But the challenge again is the implementation of these laws is not proper, so we have to work on that side. Then Pakistan developed AMR National Strategic Framework in accordance with WHO AMR Global Action Plan in 2016. And in the light of this global action plan, in the light of this AMR National Strategic Framework, Pakistan developed its first AMR National Action Plan in 2017. And we have already revised this National Action Plan in 2024 as well. So the most important objectives of this National Action Plan includes improve awareness and understanding of antimicrobial resistance so that everyone is aware of the issue, what the issue is, so that if we want to put some control efforts, so everyone recognize the importance of the issue and start working towards that. Then we need to strengthen our knowledge through surveillance and research. We need to know that what is the prevalence of resistance of different antibiotics or in different organisms. So we need to have this information if we want to develop some control measures. Then reduce the incidence of infection. I mean, as we already talked about infection prevention and control, so that if there is no infection or less infection, less use of antibiotics. Similarly, optimize the use of antimicrobial agents. As we know that today, if we can purchase or buy antibiotics from any medical store, anyone can buy that. So we need to place some measures that antibiotics are used when they are required. So this is optimized use. This is one of the objectives of a national action plan as well. And then we also need to develop economic case for sustainable investment based on country needs and increase investment in new vaccines, diagnostics, and other interventions. As we know that if the policymakers are not aware of this issue, if we tell them that this is the significance, this is the money which we are going to save if we control this issue, then they would be willing to spend some money on the control efforts, or they would be willing to allocate some funds for the control of this problem. So we need to develop our case, economic case as well. If we talk about animal health sector, this national action plan emphasizes the phasing out of use of antibiotics as growth promoters in food producing animals. And in that case, Punjab government has already taken some steps. They have developed a list of antibiotics which cannot be used as a growth promoters. So we need to extend it to the other provinces as well. Then we need to have better disease control strategies using biosafety in vaccinations and establishment of AMR surveillance system and initiation of AMR stewardship plan to reduce the level of AMR in food producing animals in Pakistan. So as we talked about the surveillance as one of the important objectives of our national action plan, especially for animal health sector as well, we need to have a surveillance plan in order to start the surveillance of AMR in livestock sector. So we developed national AMR surveillance strategy or guidelines for healthy food animals. These guidelines provide all the basic information that what are the animals or species of the animals which will be targeted for surveillance, what are the organisms which will be targeted for surveillance, what are the antibiotics or different panels of antibiotics for different bacteria which would be targeted, then what are the guidelines of doing AST which we can use. All this information is available, and then it also provide information regarding the flow of the data, how the data would flow from the lowest level or from the farms to the AHC office, and how it can be communicated with the other sectors like NIH and environment sector. Then we have also developed the guidelines for AMR surveillance in sick food animals. When we talk about the surveillance in animals, it is slightly different from the humans. In humans, only diseased humans are surveyed, or AMR surveillance is only going on in the diseased humans. But for the livestock sector, we have to do that for healthy animals plus diseased animals. For healthy animals, because they are being consumed by the humans, so we want to curtail or minimize the transmission of these organisms to the humans. And we need to have this surveillance strategy for food animals, in sick food animals, because we want to know that what are the antibiotics which are more effective for different pathogens. So in order to develop our antibiotic prescription guidelines, we need to have all this information. So Pakistan has developed this AMR surveillance strategy for sick food animals as well. Then we have developed the surveillance guidelines for aquaculture and fisheries, again, important sector. But as we are focusing on poultry only, so I would just, Pakistan has also developed antimicrobial use prescription guidelines for veterinarians in Pakistan. But unfortunately, these guidelines are general guidelines. These are not specific guidelines because the data which is required to develop the specific guidelines is not available. we need to do to increase the surveillance so that we can have more information, so that we can develop the specific guidelines for antimicrobial prescription in humans. Now I would just talk about, as I talked about, we have developed the guidelines for healthy food animals and sick food animals. So we initiate to implement these guidelines. We initiated AMR surveillance pilot in healthy food animals of Pakistan. Ministry of National Food Security and Research, in collaboration with Fleming Fund, conducted a nationwide pilot AMR surveillance in healthy food animals. The target animals were cattle, buffalo, and poultry. Here, I would just limit myself to the poultry sector, what we have done for in the poultry sector. So we targeted healthy commercial broiler poultry, and the sampling sites were 8 peripheral sites. As you can see, the Gilgit, Muzaffarabad, Mansehra, Peshawar, Quetta, Karachi, Lahore, and Rawalpindi. And the fecal samples were collected from these sites. This study was carried out, or the pilot was carried out, July 2020 to December 2022. And all these central sites collected the samples and shipped these samples to the National Reference Lab for Poultry Diseases. And the target bacteria were E. coli, Salmonella, and Enterococcus, which were targeted for isolation, identification, and antimicrobial susceptibility testing. And we use this diffusion method using CLSI guidelines for AST. And we use the panel of WHO's highest priority critically important antimicrobials and highly important antimicrobials. So the highest priority critically important antibiotics and highly important antibiotics included for Salmonella and E. coli, these were azithromycin, cefotaxime, ceftazidime, ciprofloxacin, nalidixic acid, and others were for highly important antibiotics. And for Enterococcus, highest priority critically important antibiotics were teicoplanin and vancomycin. And we use European Union summary report to describe whether the prevalence is high, low, rare, or very low. So we can categorize them into like 7 categories on the basis of the information available. So we collected 2,317 samples. We could isolate 1,456 E. coli isolates and 417 Salmonella and 300 Enterococcus isolates. So you can say the prevalence was like 63% for E. coli, 18% for Salmonella, and 13% for Enterococcus. And if we look at the antimicrobial susceptibility profile of these for these organisms, for E. coli, for example, if we can see the antibiotics with the blue star, they are highest priority critically important antibiotics. You can see that the ciprofloxacin and nalidixic acid, they are highest priority critically important antibiotics, but they were very high resistance observed against these antibiotics in Escherichia isolates. Similarly, the other antibiotics like ampicillin, tetracycline, trimethoprim, they also had very high resistance pattern observed for E. coli isolates. Similarly, for Salmonella, we observe, for example, for nalidixic acid and ciprofloxacin, highest resistance was observed in Salmonella isolates. And similarly, if we look at the Enterococcus, the highest priority or the highest priority critically important antibiotics were not as resistant as we can see for E. coli and Salmonella, but tetracycline and erythromycin show the highest resistance against Enterococcus species. So the results or the detailed results of or findings of these surveillance pilots are available in the shape of a report, which is available online as well, and you can use this link to get this report, and you can read all the details available for antimicrobial resistance surveillance pilot in healthy food animals. So what next? Once we have done this surveillance pilot, what we need to do? Number one, we need to have sustainability in the surveillance in the healthy food animals. For example, as long as Fleming Fund is supporting this activity, we are carrying out this activity. But government of Pakistan needs to come in to join the effort so that we can sustain this activity if in the future if the Fleming Fund stops supporting this activity. Similarly, we need to initiate our AMR surveillance in sick food animals. We have already provided the training to the public sector and some private sector labs regarding this surveillance in sick food animals, and they have started sharing data with the AHC office. So soon the report regarding this AMR surveillance in sick food animals would also be available. So the challenge is of sustainability, and we need to convince our government and policymakers so that they can put some funds for this activity. And again, the responsibility for our future lies in our own hands. We must preserve the efficacy of antimicrobials for generation to come and to avoid the catastrophic consequences of antimicrobial resistance. Thank you.